Good morning all. Today we are going to discuss about the topic personal hygiene. I am Mrs. Golden, working as tutor in MMM College of Nursing. So the objectives are, at the end of the class we will be able to see about define personal hygiene, what are the factors influencing personal hygiene, list the importance of personal hygiene, explain hair care, elaborate the skin care, and what is hand hygiene, explain nail care, elaborate the oral hygiene, and what are the effects of poor personal hygiene. Definition: hygiene is a science of health and its maintenance. Personal hygiene can be defined as the self care by which people attend to functions like bathing, toileting, general body image, and grooming. Hygiene can be a highly personal matter which is determined by individual values and practice. So, personal hygiene involves the care of skin, feet, nails, oral and nasal cavities, teeth, hair, eyes, ears, and perineal areas. Factors influencing hygienic practices. So there are five main factors which influences the hygiene. The first factor is culture. So North American culture places a high value on cleanliness, but many Americans bath or shower once or twice a day. But whereas people from some other cultures bath only once a week. Some cultures may consider privacy as the most important factor for bathing, whereas the other practice communal bathing. Body odor is offensive in some cultures, but in some cultures, body odor is accepted as normal. The next factor is the religion. So, under religion, ceremonial washings are practiced by some religions. The next factor is environment. So, financial outcome may affect the availability of facilities which is available for bathing. For example, some homeless people will not have warm water in their homes, and soap, shampoo, shaving lotion, and deodorants may be too expensive for people who have only limited resources. So, this is also a one main factor which influences the hygienic practice. The next factor is developmental level. Children learn hygiene in the home by their parents. Practices vary according to the individual's age. For example, if we take preschoolers, they may carry out most of the tasks independently with the parents' encouragement. Health and energy. All people may not have the motivation or energy to attend to hygiene, but some clients may have neuromuscular impairments which may be unable to perform hygienic care. Personal preferences. Some people may prefer a shower to a tub bath. The time of bathing also varies, for example, morning versus evening. Now we are going to discuss about the importance of personal hygiene. The first one is the body image. A clean and well-groomed body may establish a good body image, and it influences the self-esteem, confidence, and motivation. Social effects. By ensuring our body is clean and well presented, we may assure projecting a positive body image which may reflect our personality in the society. Health effects. Poor hygiene may lead to the poor health. For example, if you have a wound in your hand, it should be cleaned and dressed suitably, which may help to reduce the risk of infection and pain. Next one is the psychological effects. By being well presented, clean and tidy, people may feel more confidence, especially in social situations. This casts a positive psychological impact in our brain. Now we are going to discuss about the hair care. We all know that hair is made up of dead cells. Hair is very important, which may bring oil to the surface of the skin. Hair helps warm the body by trapping a layer of air next to the scalp. So, what are the tips under hair care? You must wash your hair regularly with shampoo. You must rinse your hair thoroughly with clean water after shampooing to remove all the scalp soap. Don't scrub or rub your hair too hard. It may irritate your scalp and it may damage your hair. Massage your scalp well so it may remove the dead skin cells and excess oil and dirt. Brush your hair regularly. Wash combs and brushes frequently. Do not share your combs or brushes to other persons, etc. So brushing your hair, brushing helps to keep the scalp clean by loosening and removing the dust and dead cells. It may also add shine to your hair. So common hair and scalp problems and its treatment. So common hair and scalp problems that may occur in your hair and scalp are dandruff, head lice, and splitting and breakage of your hair. So to avoid and treating the head lice, you must not share your combs, brushes, hats or braids or other hair things and your headphones. Use a special shampoo and wash your hair immediately. Any linens or cloths that you are used should be washed in hot water or dry clean. So treatment for splitting and breakage of hair. Too much heat also can cause the layered cells of your hair to split apart and even break off. Wind, chlorine and chemical treatments and permanent hair dye can weaken your hair in the same way. If you put your hair in a ponytail, use a coated rubber band or soft cloth hairband. Non-cushioned or uncovered elastic bands may cause severe breakage of your hair. Now we are going to discuss about skincare. Bath or shower regularly using soap. Do not scrub your skin violently. If possible, bath or shower after an exercise, especially after sweating. Use antiperspirants, which decreases the perspiration and cover odor with the manly smell. Wear clean clothes. Maintain a healthy diet. Wash your face 2 times a day. Avoid washing too often as the skin may become irritated and dry out. Keep your oily hair away from your skin. Avoid touching acne except when washing. So do not squeeze or pick the pimples. Try to avoid touching the face frequently. Keep your hands clean by washing them often. Protect yourself from the sun. Wear a sunscreen and reapply it every hour. Wear a hat, t-shirt and sunglasses to protect yourself from the sun. Drink plenty of fluids and protect yourself from the UV rays. Now we are going to discuss about hand hygiene. There are many germs and infections prevailing in your hands. In hand hygiene, first wet your hands and apply a liquid or a clean bar of soap. And next, rub your hands together and scrub all safe surfaces, especially palms, fingers, and in between your fingers. Continue it for 10 to 15 seconds. Soap combined with the scrubbing action, which may help to remove the germs. Rinse well and dry your hands. Now we are going to discuss about nail care. Nail care, keep your nails trim, but do not cut your nails shorter than the skin level. Keep your nails clean. Round your fingernails slightly when trimming them. Cut your toenails straight across. Smooth rough nail edges with a file or an emery board. Cuticles care, clean and soften your hands in a warm water. To keep your cuticles neat, push them back after soaking your hands while they are soft. You may also use cuticle remover, a chemical which dissolves the cuticle. Now we are going to discuss about oral hygiene. Chew your food thoroughly, speak clearly, which will enhance shape and structure to your mouth. So the common dental problems are halitosis, tooth decay, plaque, tartar, and periodontal disease. Oral care, brushing and flossing. Daily dental hygiene routine that consists of brushing for 2 to 4 minutes and flossing. If possible, brush after every meal or rinse your mouth with warm water. Use an soft and bristled brush. Replace your toothbrush every 2 to 3 months or after any illness. Use your toothpaste that contains fluoride. Flossing also removes the food trapped between your teeth and gum lines, which cannot be removed by rinsing and brushing. Dental care. Eat least 5 servings of fruits and vegetables each day. Include foods that contain calcium such as milk and yogurt. Limit the intake of sugar. You must see a dentist every 6 months. Effects of poor personal hygiene. So, side effects of poor personal hygiene are low self esteem, risk for infection, social embarrassment, increases the chances of scabies, lice infestation, athlete's foot, and bad odor. Thank you all.